Thanks for staying with us here on eNCA. Now, health experts say people above the age of 60 years old are more likely to suffer severe coronavirus infection than other age groups. Some may feel confused as well, without actually understanding the pandemic and why the country is in lockdown at this time. Now, Chief Technical Specialist Precious Robinson is with the Right to Care NGO, and she joins us now live. Thank you so much for joining us this morning, Precious. Now, the conversations we've been having over the last few days, the one thing that's come up as a golden thread is that because of the very short space of time that government has had to organize this lockdown, that communication has been a major issue, that the messaging hasn't come across to as many people as we could possibly need. What has been your experience? When you're dealing with the elderly, many of them are not on social media, perhaps are not in a position to stay abreast of the news, live in poverty as well. What has been some of the challenges in communicating this message about why this lockdown is needed, especially to a high-risk group like the elderly?
Thank you for having me, and good morning to you and the viewers at home. The challenge is currently, as we are seeing, the messages that are going out are confusing. And experience has shown that the elderly, like you rightfully said, are not on social media, are not communicating with us on other networks. May be anxious, and most of them are like, what is it? What is happening? Suddenly we are confined to our houses, and nobody is telling us what is happening. The biggest fear we are having here, what we are having is that, like you rightfully are saying, statistics are saying they are the most vulnerable and at risk because of their age, because their systems are their immune system are compromised. And most of them are suffering from pre-existing medical conditions like your diabetes, your hypertension, heart conditions, respiratory conditions. Others are on cancer medication. You know, the list is endless. And for us just to say lockdown, and there's nobody who is sort of allaying the anxieties, giving them proper education on why it's about them. It's not just about them, it's about society at large. And then for them, you know, our elderly are a little bit stubborn, if I may use that way. You say, go, you have to stay home, don't go to society, or they say there's a death or a funeral somewhere. Oh no, I have to go. I cannot just stay, because they don't understand what's going on and how it affects them and why they necessarily have to stay home. Now, recently, we have seen how even young ones are defying the rules. They go out, they go drinking, they go out, they travel to places where they're not supposed to travel, even though they are aware that they may have been exposed to the virus. And what happens, where they are going to find this elderly who are their grandmothers, who are their aunts, who won't know that they are at risk, and they greet them, they hug them, they interact with them. And that's why we are saying we need to intensify and be so stern with this elderly and the at-risk population for us to be able to close the gap and flatten the curve of the COVID-19.
Well, if there's anything that COVID-19 has taught us, and what we've seen in other countries, that this indeed is a time where there's no place to be selfish as a member of the society, that in as much as you might be young and strong, and we have seen cases of COVID-19 amongst young people abroad, so you're not completely immune, but the danger being that you could pass it on to somebody that is far more vulnerable, especially amongst the elderly. Now, Precious, what can we do as a society? Organizations can only reach so many. Only so many people amongst the elderly are able to be privileged to be in an old age home where many are facing very, very strict precautions amongst the lockdown. What can we do to ensure that our elderly are safe during this time?
What we are saying is, let's all be responsible. Let's all join hands with our government that is working tirelessly around the clock, the partners, the NGOs, the community-based structures, and support this vulnerable group. Not even them, their families, and the society at large. Let's also look at those that are amongst us and around us who needs to go shopping. I mean, we all know that recently people are using shopping as the reason they are out there. Can we then look at the elderly people and offer them to do shopping for them, especially relatives? But then when you are to do that shopping for them, can you not go and touch them? Maintain the distance, the 1 to 2 meters away distance when you are dropping the groceries. Can you educate them on the need to wash their hands constantly now and again, every time they've gone to the bathroom, every time they've touched surfaces, every time they are doing this, wash your hands and use soap and rub for at least 20 to 30 seconds and use warm water. We all know that this virus that is causing the COVID-19 is actually layered by fat. And science has proven that when we use soap, that fat can be disintegrated. You also need to use sanitizers. But then how many of our elderly people can afford a sanitizer or they have? Soap and warm water are the best for them. So that's what we need to teach them to do. We also need to teach them to always, when you are young ones and your grandchildren are saying, Granny, we want to come over, they are the ones who need to say, I love you, I want to be with you, but let's wait up until this COVID-19 curve has been flattened. Then we
Precious Robinson, thank you so much. I think we're going to have to leave it there.